The next four images are of the upper mediastinum. In some patients, we are interested in scanning almost from the base of the neck down to the diaphragm, particularly if the patient may be at high risk of having a bronchial carcinoma. And in some instances, we may scan all the way down to the pubis. The scanning is so fast that it is sometimes worthwhile not limiting the study to the heart. The first anatomical section is to the left of the trachea, where we can see the origin of the brachiocephalic arteries. The next is a CT of this same segment done with color imaging, where we can see in white the calcific densities at the origin of the innominate, the left carotid, and left subclavian arteries. In red is the muscle and the aorta. In yellow is the fat. In black, the lungs. The next two anatomical sections are a little bit above the previous one, where we can see the trachea, and on both sides of the trachea, the right and left carotid arteries and the right and left subclavian arteries. And finally, the next is a CT section with color rendition, where we can see the brachiocephalic arteries in white because of the calcium in the walls of these vessels. Magnetic resonance imaging is a competing technology which allows for the visualization of the epicardial portion of the coronary arteries. However, it is silent to calcific deposits. In other words, calcifications are best detected and quantified with computed tomography. The next five images represent anatomical sections of the heart and are correlated with MR images. The first two images reveal the heart close to the diaphragm, where we can see the muscular left ventricle. The next image is a four-chambered view, where we see the right ventricle with trabecula, the left atrium behind, the right atrium to your left, and the muscular left ventricle to your right. The next image is an MR section which shows the four chambers of the heart. Note that sometimes the thinness and the plane of recording of the intraatrial septum may mimic an atrial septal defect. Note the right ventricle in front, the left ventricle to your right, the right atrium to your left, and the left atrium between the descending aorta in the left paraspinal region and the ascending aorta in the center. Note the bright signal surrounding the heart, which represents fat. And the last two images, one is an anatomical section showing the aorta in the center of the heart with the left atrium behind in front of a calcified descending aorta. And then the MR image of the same plane revealing the aorta in the center with the right ventricle in front, the left ventricle to your right, the right atrium to your left, the left atrium between the aorta and the descending part, which is calcified and surrounded by fat. Axial images at the aortic root can reveal the origin of the coronary arteries. Here we can see the takeoff of the right coronary artery, which arises from the anterior sinus of Valsalva. The next image shows the origin of the left coronary artery, which is directed dorsally and to the left. MR can show patency of a graft, as seen in this coronal image, where one can see a graft to the right coronary artery and another one that goes from the aorta to the LAD.